Hello?
Okay. Can everyone hear me okay?
Perfect.
Okay, welcome. Hello, everyone. Thanks for coming on this hot day here. We have plenty of water in the back, so if you need some more, just raise your hand. We'll come bring you some. But my name is Kristol. I'm the Vice President of Business and Development here at Nazareth At Home. I've been here 19 years, so we are very grateful to have our speakers today. We do what's called Community Ed Series and educational series, and a lot of you, I think, have been coming to some of these, so we appreciate you coming. And we always try to bring some topics in that you all have told us that you would be interested in learning more about. So downsizing was one of the topics, so this is our opportunity to share that with you all. Before we get started, I wanted to share with you all our new service that we started not too long ago. This year, the beginning of this year, is our new Nazareth At Home care service. So I'm going to introduce Hannah Brunnerman. She is our director of that program. Just let her tell you a little bit about it, and then we will go on with our presentation. And I'm going to go ahead and just let them introduce themselves so they can tell you a little bit about themselves. If you need anything, please just let us know, and thank you for being here.
Hi everyone, my name is Hannah Brunderman. So I'm the director of Nazareth At Home. So I was hired about a year ago to get this program up and running, and it took us a while to get our license, but in January of this year we started accepting our first clients. So now we're well established and we're growing, and we're really happy with the quality of our service. So we try to maintain the great reputation that Nazareth has and the care that people receive here, and try to replicate that in the home. So a little bit about the service. We're completely non-medical, but we can help you with things like bathing, grooming, dressing, medication reminders, and then also like homemaker services. So grocery shopping, meal preparation, even pet care, laundry, light housekeeping. So anything to just keep you independent and dignified and safe at home for as long as possible. So we thought we sort of would tie this in with downsizing, just discussing being home with the speakers today. So if you want to talk with me about the services, we'll be outside for a little bit. There's a flyer out there that's pretty describes everything pretty well, but I will put my business cards out there too. I would love to speak with you. So start over there. Thank you.
Hi everyone, can everybody hear me okay? Awesome. So I'm Cindy Bush with Simply Shift.
And I'm Kristol Yeager with Get Ready.
And we also like to say get ready to simply shift to the next place you call home. So that's what our business is. We collaborate instead of competing against each other. So, I'll give you this.
Hi, and I'm Joseph Brooks with Brooks Family Medical. We are a primary care house call practice in Louisville, Kentucky and surrounding areas. And we can talk more about that here in a minute, but we are actually at this point the largest primary care house call practice in town. We've got 6 providers and are currently serving about 1,200 people who are not necessarily even homebound, but if you are having difficulty getting out to a primary care provider, we come to you. So that's why I got invited here, because we're talking about a little bit of really kind of the transition from whether it's transitioning to a smaller home, downsizing, or really just staying home, and what that looks like to do that safely and independently is kind of what we're talking about here. So we can go ahead and talk about what I do, and then we'll go into the Simply Shift side of it here. But we serve all of Jefferson, Bullitt, and Oldham County in the home, and it is primary care. So anything that can be done in the primary care office can be done in the home, as far as we can get blood work done in the home, we can get ultrasounds and x-rays done in the home, prescribe all of your medications, and then coordinate with any specialists that you are dealing with. And oftentimes for people who cannot get out to their specialists, we end up doing that too, as well. But in addition to those services, we accept all major insurances. So this is not concierge medicine. This isn't direct primary care. This is truly covered by your insurance. If you have Medicare and a supplement, it's going to be 100% covered for our visits. And then really just whatever you would pay if you have a copay at a primary care office is what you would pay for a copay for us. So it's the kind of the same thing there. We work very closely with home health agencies, so your skilled nursing, your occupational therapy, speech therapy, physical therapy. We have relationships with all of those companies in town, and also the non-medical, just like Nazareth At Home. We work very closely with all of them, essentially to provide your primary care, but then we plug in all the pieces around it to make sure that you can safely stay in home or wherever you want to live as long as possible and not have to move to a higher level of care. Or if you do end up wanting to move or downsize to somewhere where you get a little bit more safety, we can follow you there as well in assisted living facilities, independent living facilities, and that sort of thing. So essentially, we're just your primary care provider that comes to you instead of you having to arrange transportation and go out to them. I had mentioned that we can get the imaging and lab work and everything in the comfort of your home as well. So our goal essentially is just for you to be able to age in place wherever you call home and do it safely. So, why that matters, as part of this kind of community education series, both us and Simply Shift and Get Ready, we want to support everyone in their journey to senior living, whether that's moving to senior living or assisted living or memory care or skilled, but then also just strategies and care systems to keep you, if you aren't moving, keep you where you are safely, because there are tons of barriers that come up, whether it's memory, whether it's too much stuff in your home, transportation, finances, all of those things, those social determinants of health that really affect your health. It's not just your medicine or the diagnoses that you have, it's really everything. Health is not just a silo, it's a system that needs to be supported and taken care of. So I'll shift over and let Simply Shift talk about kind of what they do in those regards.
So, Get Ready and Simply Shift, we both provide these services together, and I can real quick just tell my background as well as Kristol tell her background and why we kind of got into this. So I've been in healthcare for 16 years and have worked in senior living and in non-medical home care. So I've seen both the amazing times that family had with transitioning to senior living, but how overwhelming it was getting them from point A to point B and downsizing and transitioning to their next home from the home that they've lived in for several years. So I've also seen from the non-medical home care side, and it's different for everyone. To some, it works out great having home care come in and having a medical team come in, but if it gets to the point where Dr. Brooks had mentioned, Joseph Brooks, has mentioned as far as safety hazards or transportation or just issues that he sees coming into their homes, those are things to be mindful of and ways that we can come in to help. So that's kind of where Simply Shift started for me. I'll let Kristol take over and tell her background.
My background is in real estate. I moved to Louisville in August of 2023, and then staging some model homes or model rooms for senior living when a lot of the employees said, would you be interested in coming in and helping seniors because they don't have family or the family's busy and they just don't know how to get everything together. So it was like a light bulb went off and I thought, this is what I'm going to do. I can sit down with the senior and figure out what items are best to take that's going to fit in their room, so we can lay that out and get it organized so you don't end up Cindy said, that you are living in now, and just help declutter. Just help get rid of some of the things that may be causing anxiety because you're just overwhelmed with 30 to 50 plus years of stuff that you don't know what to do with. And I'm going to be the first to tell you, your kids don't want it. So we need to go ahead and donate it now. Now, we work with a lot of great charities that will, come to the home and help pick up, and so that's how I got started. And then I was lucky enough to meet Cindy, and then we just started collaborating on jobs, and we work really well together. And we love working with seniors and just helping everybody be safer and be in a great environment.
So some of the services, I know we've mentioned most of these, but as far as decluttering goes, making your home safer, whether that's physically your home or if you transition to senior living and just have stuff everywhere and it's a fall hazard, or there's things that we know this area rugs can be a trip hazard, extension cords can be a hazard. Those are things that we look for when we're doing assessments and visiting people's homes. So transitioning to senior living, I know it's case by case, so that's why we always do a free assessment to get to see how much or how little you'd like for us to be involved. Because we've done little moves where we meet the day before or the day of and box everything up, help you decide what to take, what not to take, and what to donate to charity, and what you just let go of. If it's not going to be donated and not sold, it needs to be thrown away. So we can help that much, or we can just help you with the day of the move. Or we could also help the day of the move, and then if you decide a couple weeks later down the road after you've been settled to come back and get whatever's left in the home where it needs to be. So yeah, sorting, packing, unpacking, staging your new place, organizing, managing donations, which Kristol said we work really closely with some local charities. I know Chris Clements over there with Project Worm. We've donated a lot of blankets to him. And so we're always looking for, if it's things that no longer spark joy or things you no longer need and you have a ton of duplicates that have accumulated, let's try to give it to someone that needs it. And you'll feel better knowing it's going somewhere and not just being thrown away. We also manage the entire move as far as hiring the moving company. So they'll give a discounted rate, and then we just work closely with them and coordinate it, so it's one less thing for you all to have to do if you move.
And the day of the move, we will unpack everything, put everything away, hang pictures, everything will be ready. So all you have to do is, or the family member just has to show up. And it's great. It's very rewarding for us when we do move a senior and they say we couldn't have done it without you, or I love it. Like, it's the best compliment ever.
It really is. So I don't know if you recognize the seashell necklace and the seashells in this picture, but this is a client that both Joseph and Kristol and I have worked with, and she's one of my favorites. But I say that about everybody, but seriously, she's one of my favorites. We still keep in touch, and she transitioned to a senior living community after years of being in her home in Indianapolis, and wanted to be closer to her son, but just had no idea how to get there. So we were able to get her settled, and the biggest thing she had a hard time letting go of was seashells. And one of the reasons why is because she used to go to Naples with her husband, who had passed away a couple of years back, and they collected all these seashells. Now, as you know, it has no monumental value, but to her, that was one of the most important things that she wanted to take with her. She probably had a whole room filled with seashells, and since she downsized from her home to senior living, she couldn't take all of them. So we had to decide which ones were most important. She was able to make a necklace out of the seashells that her husband and her collected, and then there was a couple of cute little sentimental treasures that we were able to keep in her apartment, and we let go of the rest. And so we took some to daycares. Daycares were able to use the seashells. The kids got to use it as an activity, and then she got to see pictures of what the seashells looked like in crafts that they did together. So any opportunity that we can, I know Habitat for Humanity, we are constantly using them on a weekly basis, and they will pick up donations at no cost. Those are places that do really good things for the community, try to get people back up on their feet. We've even had the representative at Habitat that we closely work with say that she'll try and send pictures once the items of the home, or items of things that are donated go to the next home. I'll try to send pictures just with updates, so that's always really nice to see. We did not. So the family moved her physically and then just unboxing for her.
We'll go to Indiana, but not maybe Indianapolis. That might be a little far.
So this is just a before and after picture. One of the examples I like to show is they live at their home and had duplicates of several things, had expired food, expired medications. They had a grocery list on their fridge that had several items, and I would say 6 or 7 items were already in their pantry, they just couldn't find it. So when I see things like this in clients' homes, we're evaluating, if you're not ready to move, but you want to have a safer, clutter-free atmosphere, call us, because we'd love to help. And yeah, I mean, that took a couple hours to get all of that decluttered.
Yeah, to that point, we see this all the time in people's homes. The clutter just causes mental clutter as well. So when you have, someone will go into a home and someone pulls out 3 grocery bags full of pill bottles, and there's probably 3 or 4 duplicates of each pill bottle in there. Some are expired, some are not. Just like the food, the medication it expires, it gets dangerous, it's not as effective. So calling these guys here to help out with not just a move, but a change in the ability to manage your care, whether it's your medications or even, you fell and broke your ankle and now you have a walker that you have to get around your house in, but you've got these cords and clutter and everything. It doesn't have to be a move in order to utilize these guys, girls.
And getting started on this project would have been very overwhelming for that homeowner, so it's easier for us to come into and get it done in 2 hours as opposed to, them looking at it and just closing the door, or it taking 5 times as longer, so.
I know we've already kind of mentioned this, but every community, Nazareth gives floor plans of apartments that they have. So if you have a studio or 1-bedroom or 2-bedroom, we would get the floor plan if you move here and decide where to put furniture and help you really visualize it and go to your home and label what you're planning to take and not take, and just try to make it as stress-free as possible. Once you're out of your home, we do work closely with a couple of junk removal companies. So after things have been donated or dispersed to family or sold, because some people do estate sales, we can call that for you. So this was a move that we did together, our first move together over a year ago. So that was just to kind of show you, it wasn't completely done, but this is kind of a work in progress of a before and after picture of a 1-bedroom. So yeah, truly, Terry, our client, didn't have to, all she had to do was decide what furniture she wanted to take, and we handled the rest, boxing everything up, calling the moving company, coordinating it, and then while she had lunch with her daughter that was in from out of town, we got to finish her apartment and hunt everything, and she got to show up.
Yes.
So as far as like boxing up someone's stuff and kind of helping them coordinate what they want to take, what they don't want to take, is that included in the cost? Like, is there separate fees for that? I mean, for storage bins and things like that.
No, we will come out and do a free assessment and then give you a rate for that move. So we'll include the packing, the boxes and packing material. It does not include the movers, they get paid separately, but it will include the unpacking and all the setup. So that's the first. If you need us to go back after everything's been cleared out of the family, we can give you a second estimate for that. It's kind of hard to determine what's going to need to be removed until family and everything is out. But yeah,
And one thing we like to tell families too, because there's a misconception that everything has to be out of the home. It's actually easier though to move what you'd like to take, and you can always go back to your home, rather than feeling like you have to get everything out of the home and list it with nothing in the house. It's easier if you are able to get things here and decide on donation management and what family wants and all of that after. So. This is another fun project, and we're not being sarcastic. We really do love this. So
I know it makes people but we actually did this job, and not pat yourself on the back by any means, but in a day and like a few hours in the morning, we had this cleaned out. Now granted, there were some dumpsters involved and a lot of donation bins. I think the garage was full for a church to come and pick up, but we do work at a good rate, fast pace to get things done. We don't want to drag it out, but yeah, this was a basement, and a lady had moved to senior living and her family needed it cleaned up, and so.
yeah. And you can't see it, but it's L-shaped, so there's actually a whole other side. So we decided like Kristol said, we had been there, dumped that. It's a company we work closely with. Come and anything that needed to be just thrown away, because it was stuff that's been in the basement for years, several years. We filled up 2 dumpsters, and then had an entire garage that was full of donations, and had some of the family members come to figure out what kind of Christmas decorations they wanted to take that were meaningful, and so yeah, it took 2 days, not even.
Right. This kind of goes back on what Joseph said about, anxiety in the home, and if your home is disorganized. I know I feel like that when I walk into my house. The first thing I see is the kitchen island, and I can't handle when there's mail and everything on it. I need to walk in and it be, everything cleaned up. So we can definitely come in and help you get organized and set up a plan so you can keep it that way. Because I know it's hard sometimes. I know I helped a senior that was living in his home, but he would just throw his mail on the floor. I don't know why. So I told him if I came back to his house and there was any more mail on the floor, we were going to arm wrestle because he needed to throw it in the trash. He had calendars from, 5 or 6 years ago. So just throw it away. You don't need it. You don't need the receipt from when you paid your electric bill in 2019. You don't need it. Just throw it away.
I do have a list too of like 90 things to let go of. So if you don't want me to send that to you, I'm glad to.
Is that hard for like if you're meeting with somebody that's been there for years? Is that hard for them to let go of certain things? Like how do you approach that?
So in our opinion, it's a lot easier for us to come in rather than family because it takes quadruple the amount of time, because even though we care, we want what's best for them, we're not family, so it's not personal to us like it is to them. So yeah, every case is different. We've worked with hoarder situations where they really shouldn't be there, and family needs to ultimately be with us to help declutter for their safety. And Kristol and I did one a while ago that she was in rehab and came home, and physically her primary care provider told her, you cannot go home to that living environment until we come in and declutter, because it was such a fall hazard, and there's pests sometimes involved. There's so many things to be mindful of. So no, I think we do a good job kind of talking through and gaining their trust and helping them decide, if it doesn't spark that much joy and you haven't used the spoon that's in the drawer that you have 15 spoons, maybe we need 1 or 2, but not 15. So those are things we like to talk through with families. So this is just another fun fact. Only use 20% of the 300,000 items in our homes.
And if you sit and think about it, I'm sure you all can think about the 20. Yeah.
Yeah. Everybody's gonna fill up boxes today. Going home and immediately cleaning the closet out. Another fun, did you know, letting go of unused items can reduce stress by 60%? I feel like that's 100%, but it's just me.
Yeah. Searching for misplaced items is it back redone.
2.5 days out of your life a year. It's crazy. So we always do a free assessment for anybody that would like to know more about our services and just get to learn your goal and vision, and if you're moving, how soon, what your plan is in place, where you're moving. Those are all questions that we ask on the assessment to get to know the situation better, not situation, the move better.
Oh, well, it could be a situation, you may not be moving, so, yeah. Right. But I feel like we're flexible on our hours and the days we work, so don't feel like, you know, we've gotta be there Monday at 8 o'clock. We can work around everyone's schedule, and yeah, we do got a part of it, you know.
Yeah, from our standpoint, it is completely covered by your insurance. And really to get set up, it's as simple as calling our office and saying, hey, I want a new patient appointment, and we will come out to you and do that. Yeah, it's as simple as getting a new primary care, and at that point, we reach out to your previous primary care, get records and everything like that, and then at the new patient appointment, we would get all of your history kind of all gathered and put together, develop a care plan for you, and then also coordinate with any specialists, home health, therapy, anyone else that is involved in your health as a whole. Does anybody have any questions? Is that what we're ready for?
Yeah.
Any questions for either of us?
Just curious, do you mind if we go around and ask what made you all decide to come to this event, or what sparked coming? If you don't mind. Just curious. Can I go with you first? I'm glad.
I guess somewhat to be more organized.
Okay.
I like the idea of the floor planning. I mean, I've got things sorted, but when is the last time we used it, you know?
Yeah. Yes.
Well, that's another thing, you have seniors that will put things in storage units.
Yeah,
Storage
how
units,
does that
because
happen?
you're just spending a lot of money per month for something you're not using.
Well, and I can't tell you how many times we've walked into homes and people will buy like the same shirt like 10 different times because they can't find a shirt, and it's like, it would save you money if you had a little bit more of an organized home environment. So, just something to keep in mind. What about you all?
We're looking for resources. It's pretty clear that someday, along the way, we will need, you know, our goal.
Thank you all for coming. What about you all?
And I had to put my husband in a nursing home last year, so have my mother living with me at home and just thinking about future and for anything I might not yet know about. See what's coming. And I brought her with me. I nurse this too.
Wonderful.
However, I did just go through this over the last year and a half of getting computers. And, with regards to you all doing it as opposed to technology, she can get a little bit cranky. And she also thought, a lot of times if we were trying to encourage her to get rid of something, you all just don't see that. Where if somebody outside the family did it, it wouldn't come across that way, sure. Now, you know, just taking it as an example, but that's just note to self.
Yeah.
Going forward.
We see that often, so you're not alone.
I came from more of a professional, to help others that come out in the community, and I know, but I also have a team who has tons of friends that are going through transitions and issues with going through as well. So we will to offer and empower them.
What about you all?
I'm a retired nurse and I was in home health for 30 years, so I saw a lot of different home situations. We were
good to take care of it because I, as the daughter-in-law, took care of, you know, a lot of Ralph's family, and they, couldn't no longer keep up and all at once, take them and put it in assisted living, so, don't want that to happen. And we've been in our house 23 years, and so we still got stuff for the kids.
Mm-hmm.
That they won't take because they live in their house to go. When we get a bigger house.
Yeah, I have a question. I just recently learned that the place you donate your tools called Tool Library over the road. You ever worked with them?
Oh, we have not, I have heard of them before, if anybody probably knows about the tool library, it's Chris Clemens sitting right in front of me. But, yes, I am aware of it only because, Cheyenne, our contact with Habitat, had mentioned it. But if you want to give us your number, we can get you in contact with that person.
Well, you know I love you. And definitely support what you're doing. And as you know, I'm a Project Warm, so I mentioned to you all and some of the others. We do a lot of outdoor housework and fix-up work. So when I go to a house, you talk to people and you look inside a house like, ooh, they need Kristol and Cindy. Just for safety purposes and just to help them be organized and stuff like that. So even as a 50-year-old and with kids, I need to declutter and reorganize. My kids are older now; they don't need all those toys and things, and we need to kind of do our own little simply shift.
Yeah, I met a lady in Lexington to do some organizing, and her kids, she was like, oh, I'm finally cleaning out my kids' rooms. I'm like, oh, how are your kids? She was like 27 and 31, and I'm like, she still had their baby shoes, she still had their Legos. I'm like, okay, well, at least you're working on it, like, to get it cleaned out, but she had just left all of those things in those rooms for all those years. I mean, I know there's things that are sentimental, but like Cindy showed the picture of the seashells, like, just keep a few of the items that you enjoy and just make it look precious, like the little containers and, yeah.
It's not a lot of live more with less. I mean that. Does anybody have any questions or anything else to add? I don't know how we're doing on time.
You're great.
You're doing
Okay.
great.
Well, I'm glad everybody came today. I hope you all learned some more useful information. I love working with these guys, so you're in good hands if you ever need anything or just need a resource. So,
There, I see, phone numbers for
Oh, we have some cards outside, so our email address and our phone's on there. So if anybody needs, just tips on decluttering, we have like a 30-day declutter calendar you can do. If anybody wants a charity list with the local charities because you want to see what you do have, we can send that to you. So if there's anything, just give us a call, text, or email, and we'll give you the information.
Thank you all so much
Thank
for
you.
being